I'm Dr. Rob Almeida. Thanks so much for watching this video. As you're aware, right now, healthcare does not have an answer for your pain. Drugs and steroids and surgery, they just don't work. They don't regrow new tissue. Today, I'm going to show you that science now has a way to fix your pain. Today in this video, I'm going to introduce you to regenerative medicine. We'll go over a few case success stories, and then we'll talk about some approaches, some traditional approaches that just don't work. After that, we'll talk about our procedures and our success that we've had with our no drugs, no surgery approach. Last in the video, we'll answer some questions about cost and insurance. So stay tuned and enjoy the video. Thanks again. I'm Dr. Rob Almeida. Bye for now. Hi, I'm Dr. Rob Almeida. Thank you so much for joining me on this video. I am so excited to help you reduce or eliminate your joint pain problem. I'm sure you're here because you have a problem and of course you want to fix it. Well, this might just be the most important video you ever watch regarding your health and wellness. I hope you're sitting down because this will be completely bonkers. You're going to learn so much from this video. Today, I'm going to show you how science has now found an answer to get rid of your joint pain. So, to start off, I want to tell you a little bit about regenerative medicine. It's a rapidly growing field of healthcare. Regenerative medicine uses biologics or human cell and tissue products to, and pay attention to this, repair, reconstruct, and replace your joint tissue. This is the descriptions that the FDA allows us to use to describe our treatments. This is why science can now fix your pain. Simply put, regeneration is the opposite of degeneration. We now have the ability to reconstruct your articulate cartilage in your joint. For those of you not familiar with the term regenerative medicine, I want to just define it for you. Regenerative means, by definition, the ability to make something new again, to bring into existence. So, of course, here in this video, we're talking about making your joints new again. A great analogy for regenerative medicine is the lizard story. You may know about the lizards that break off their tails due to an injury, and then they can regrow a new tail. They can do this because they have cells of repair and regeneration. You and I don't have new tails, but we do also have cells of repair and regeneration. In fact, when we're born, we have hundreds of millions of these regenerative cells. They're given to us by our mother at birth through the umbilical cord. That's why when you're a young adult, you can heal very quickly. But when you become older, not so much. You start to lose these cells. They start to go dormant. They are not active anymore in your body. And as a result, when your youth is over, in your young 20s, we start to develop what's known as degenerative conditions. Okay, so as older adults, by the time we reach, like I said, our early 20s, we're working on only about 10% of the actual healing power we had at birth that was given to us by our moms through the umbilical cord. The healing ability to stop degenerative processes, then to make our bodies repair and reconstruct and replace our tissues, these fade away. So a lot of you are here because you have knee pain or pain in another joint like your shoulder or hip or elbow, and this pain disrupts your life. Of course, this is not good. I think it's not good, and I think because you're here, it's unacceptable to you too. Let me tell you a story about one of our program's great outcomes. Her name was Karen. When she came into the program, she was 63 years old and she had bad knees. But her knee pain started in her 50s. It got worse and worse every year as she got older. The best way that you could describe Karen's pain was it was completely life-interrupting. She had to ice her knees almost every day. She reported taking ibuprofen drugs every day, and her doctor told her the only solution was surgery, which Karen was petrified of surgery. Her mom had passed away from an anesthesia complication years ago from a different type of surgery, not an orthopedic surgery. But even with her fears of surgery, Karen had problems with her knees. And the final straw was one summer when she was at the beach with her daughter and her granddaughters. She was not able to go on a long walk by the shore with them. She wasn't even able to get out of the chair. It was unacceptable to Karen. So, a lot like you, she saw an ad for regenerative medicine, and she watched a video that taught her about the science of regenerative medicine. She had a consultation, she had an examination, and she had a treatment in our office, which changed her life. In Karen's case, there was a series of 3 in-office injections over 4 months. But after her treatments, she reported her pain went from a 9 to a 3. She could sleep at night, she could exercise again, she could go for walks, she could get out of a chair. 6 months after her treatment, her only regret was she didn't do something sooner. Okay, so let's move forward and let's talk about some traditional treatments for joint pain. I'm sure you've all tried drugs to help. So traditional treatments in this video will include over-the-counter medications, prescription medications, opioid drugs, icing, wearing a brace, using a walker or a cane, getting cortisone injections, and surgery. We'll talk more about cortisone injections in just a little bit. One thing I want you to understand and consider is that all these traditional approaches I just named are not actually solutions. They're not answers. They're actually just Band-Aids. I'm pretty sure that you've all here, all of you listening, have tried to solve your joint pain problem with these over-the-counter medications or prescription medications, maybe ibuprofen. When people experience some pain, it's often that they just turn to drugs right away. And these are so bad for you. They're so addictive and they have other side effects. They actually make your joint pain problem worse. These drugs don't actually stop the degeneration from happening. They just make you feel better temporarily. It doesn't reverse the damage. It doesn't heal your body or regrow new tissue. These drugs are just Band-Aids. So, as I said, these medications actually make your joint problem a lot worse. They make you think you're better, and then you're able to go out and use your joint in a way you shouldn't, and that actually speeds up the degeneration process and makes the joint worse. They cause temporary pain relief. Maybe they cause pain relief for a few hours or a day, but they also cause degeneration in your joint as they provide short-term pain relief. This makes you worse, and it makes you need more medication. Then it doesn't heal your joint, it doesn't regrow new cartilage, and it makes you worse. And then this pattern persists year after year. So, cortisone. I said we'd speak more about this one in a little bit. Here is a chart with some terrible side effects that cortisone drug can give you. The drug is basically a nail in the coffin for someone that has joint damage. So here's another story for you. This is Maria's story. She was 40 years old when she discovered regenerative medicine. She was an avid tennis player. Her entire social life was structured around tennis. She played the game on the weekends. She had practice in the mornings with a trainer. All her friends played it. She hosted tournaments with her club, and she played in these tournaments, and this is how she hurt her shoulder, playing tennis in one of these tournaments. So if you belong to a tennis club or a squash club, you know it's a social event as well as it is a sport. And she was devastated when she couldn't play anymore. Her entire social support structure was built around tennis. And to make things worse, she had limited mobility in her shoulder, and so she wasn't playing tennis, she was gaining weight, she had trouble sleeping, and she was starting to become anxious. So she went to her doctor, who then proceeded to do 3 rounds of cortisone injections into her shoulder. Maria reported that every injection helped, which was great, but only for a short while. The pain would then return after. So Maria's joint pain problem and the fact that at this point her only option given to her was surgery, and that wasn't an option for her, it was unacceptable. So after seeing an ad like you have, she went to a lecture and then a consultation and an exam and a treatment. Maria's treatment was also 3 injections into her shoulder done over 4 months, just like Karen's, but these were injections of regenerative medicine. So several months after her treatment was finished, her range of motion improved dramatically. This is something that never happened with the cortisone injections. And also what she noticed was that as time went on, month to month to month, her pain got less and less and less. And that was the opposite with cortisone. The cortisone injections, the pain became worse a few months later. So the good news with Maria is that eventually her pain did get good enough that she could start playing tennis again. And that was a great outcome for her. So like Maria, many of you may have tried cortisone injections already. It's important for us to make sure that you understand that there are risks involved with cortisone injections, because this is something that many doctors prescribe before you have surgery. It's important to understand that cortisone injections don't last forever. It's only a Band-Aid as well. It only lasts for a few months. And again, it's actually not a solution. It's not a fix. Cortisone is not regrowing or regenerating any tissue in your joint. It's not growing your articular cartilage back. It's not healing your body. It's literally just a Band-Aid for your joint pain problem. In fact, it can degenerate your joint cartilage even more. The FDA tells doctors to limit cortisone injections to 3 shots in a joint, and that's in a lifetime. If you're diabetic, it will temporarily spike your blood sugar levels. So this is something you have to completely avoid. This is something that you just don't want to do. Stay away from cortisone injections. All right, so it seems that we have just a few tools in our toolbox that we can use for our joint pain problems. We can learn how to exercise and stretch in therapy. We can take drugs. We can have steroid shots. These are all temporary though. We can also have surgery, but none of these traditional methods will regrow or regenerate your articular cartilage. And when the drugs and the cortisone shots fail, the only alternative that's offered is surgery, and all surgeries have complications. All right, so on this slide here, you can see some death rates. These are not good. These were published in the Journal of Bone and Joint Surgery. To put the dangers of surgery into perspective, I have a favorite analogy I like to use. And so here it is. If I've offered you a bowl of candy and there's 100 candies in the bowl, and I said to you, go ahead and have 1 candy, but 7 of the candies in this bowl will kill you, would you pick a candy out and eat it? Surgery is something you absolutely want to avoid. So we know that surgery is dangerous. Let's speak briefly about my friend Sean's dad. He was excited to have just retired. After decades of hard work, he was looking forward to personal freedom and traveling and spending more time with his family and his wife, the things you do in retirement. Finally, after decades of working, he had the happiness that only personal freedom and personal accomplishment can provide you. However, he had little independence. He didn't have full mobility. He wasn't really enjoying his freedom the way he should have because he had a knee pain problem. He was told by a surgeon he needed a joint replacement, and he felt that after this surgery, he would be able to enjoy his retirement as he imagined. But this was not the case. My friend Sean's dad suffered a post-surgical infection, and he passed in less than 30 days after his knee surgery. This is a harrowing story, but we know from the citation here that this can be an outcome. All right, so let's move forward a little bit. Talking about knee replacement surgery and the costs and how much money it costs. Around in the 2021, the normal amount that you would pay for a knee surgery, a total knee replacement, is anywhere from $45,000 to $70,000. So let's say you have a 20% coinsurance. That could be $10,000, $12,000, $15,000 out of pocket for you for this knee surgery. And then on top of that, you're going to need a long rehabilitation period, 3 to 6 months. You're going to lose money from not working. You're going to have to go to all the therapy appointments. It's going to be a lot of work and a big commitment. So the point, besides being dangerous, is that surgery costs a lot of time and also a lot of money. And just a side note here too, I hope that you're not watching this video and you've already had a joint replacement surgery, whether it's shoulder, hip, or knee. Because once you've had a joint replacement surgery, you're not a candidate for regenerative medicine anymore. There's no tissue, there's no articular cartilage left to repair or to reconstruct. Because once the joint replacement's been made, we just can't help you. And that's why I always tell people to do regenerative medicine first. Do this treatment first, because you can always have a joint replacement should this treatment not give you the full results you want. But you cannot receive regenerative medicine once you've had a joint replacement. It's gone. It's off the table. Even with the best insurance, joint replacement surgery is expensive, it's painful, it's time-consuming, and it's life-interrupting. There's no doubt that surgery should always be the last resort. Okay, so now let's talk about a fix or an answer to your joint pain problem. Now we're going to talk about a true solution to help fix your joint pain, but a solution that's safe and that's effective and affordable. You probably heard that your pain is normal, okay, and it's part of a normal aging process. And to some extent, this is true, because you do lose the cells of regeneration that you had when you were younger. But science has now found a way to replenish your body with these cells naturally. So many of the joints in your body that may be degenerating or injured can now be helped with biologics, and we're showing you some of these joints here right now. These are all good regions to have regenerative medicine in. I do want to let you know that for many of you here today, this can be a turning point in your life. I do honestly believe that what you're going to learn here today will dramatically improve and change your life. To give you the ability to go upstairs again without pain, to be able to go out and play with your grandchildren, or to go on long walks or play golf or basketball or go shopping, or simply just visit family and friends, to do the things that you enjoy, to do the stuff that life is made out of. I always say, if you're going to be alive, you might as well live. These products and treatments that we use in our office, as I mentioned, are called biologics, which means the FDA defines them as being isolated from natural sources or coming from living organisms. These biologics can come from a couple different places. One, they can come from your bone marrow. They can also come from your fat tissue, or they can be donated at the time of a normal childbirth. The donations have nothing to do with an abortion, which we'll cover in a little bit. Our program at XCELL Life uses 1-day-old regenerative cells, or stem cells, and also over 200 cytokines, exosomes, growth factors. You will not get these if you harvest your own fat or bone tissue. So again, some ways you can get these cells are from your bone marrow and your fat tissue. And as I said, this is not an ideal choice. Besides missing out on the cytokines, exosomes, and growth factors, another reason not to use your own bone or fat is because you already have a joint pain problem. And this is because you've lost the naturally occurring regenerative cells in your body. This happens as you've aged. Getting these cells from your own bone or fat will give you cells that are as old as you are. Not to mention the surgical extraction or harvesting of these cells can be painful and can take nearly an hour. And again, you're using cells as old as you are in this type of a treatment. They're not as effective. And because they're not as effective, the treatment times are longer, they're more frequent, and the treatment is less effective. Receiving donated 1-day-old cells that are regulated by the FDA and the AATB are clearly the best ways to repair, reconstruct, and replace your joint tissue. 1-day-old human cells can produce 1 billion cells in 31 days. But cells that are from your own bone or fat that are 60 years old will only produce 400 cells in 31 days. This is a huge difference. Older cells are not good. So this next story is a great example of why we don't use older cells. This is Julia's story. She was 75 years old, a senior with some understandably underlying health concerns. She would not have fared well with a surgical harvesting procedure to take her fat out and get stem cells. And of course, her naturally occurring stem cells were 75 years old. They were degraded. They didn't have a lot of potency to them. But she was having a lot of problems with her mobility. She wasn't able to go up and down stairs, and she was thinking she may need to be in an assisted living situation. So she went to her surgeon, who told her she needed to have bilateral total knee replacement surgery. That is, having your right and left knee done, both of them. Well, she didn't decide to do that. She decided to have instead bilateral regenerative medicine therapy. And let me tell you, a few months after that, her pain level drastically improved. She reported her pain was a 10 on 10 originally, and she said it was virtually gone months later. This was life-changing for her. So, I mean, that was a great outcome for Julia. Even with bilateral knee surgery at 75, she may have still ended up needing some sort of assisted living. So stem cells, biologics, human cell and tissue products, regenerative medicine, these are somewhat interchangeable terms. When you receive regenerative medicine, these regenerative cells repair, replace, and reconstruct your joint cartilage. They repair what can be saved, they replace what is too far damaged, and then they reconstruct new tissue and heal your joint and your body. They produce exosomes and growth factors and so on that heal you, but also cell signal your own body to produce more of its own regenerative cells, which creates even more healing. So over time, we know that the treatment heals our body and also causes our body to ramp up and heal itself through cell signaling. We know that the bone marrow and the fat extraction is not good for this. The cells are too old. They don't have the same ability to cell signal as one-day-old cells. But we know that cells donated from a childbirth are young, one-day-old cells. They contain much greater healing potential. And an injection of this type of treatment can be given often in just 15 minutes. So there's no surgery, it's less costly, and it's a lot less painful. When a woman has a C-section or a cesarean delivery, she can choose to volunteer or donate her umbilical cord, her placenta, and her amniotic fluids that surround the baby. This is where stem cells and exosomes and growth factors and the 200 or so cytokines originate from. And this entire process is regulated from the initial collection in the hospital all the way through to the end result by the United States Food and Drug Administration and the American Association of Tissue Banks. Around over 1 million women in America every year make it through a very intensive and regulated hospital screening process. And this, of course, includes blood work to make sure they don't carry any disease. And after this is completed, they're selected to give this incredible gift to donate their umbilical cord. Then, after the human cells and tissues are carefully screened and processed, they are transferred into your body. This gives you the healing power you once had when you were young yourself. These moms are doing something amazing by donating their cells and tissues. What otherwise would just be thrown away is now giving other people the ability to repair their joints. Remember, these powerful one-day-old human cells and tissues include stem cells and other factors, and these cells and other factors, to a lesser degree, are already dormant inside your body. So when our office does this treatment of donated human cells and tissues or biologics, the first thing that happens is they wake up your dormant cells that are inactive and the tissues in your body. Again, this is called cell signaling. Your body is going to once again begin to heal itself along with our treatment healing your body. We're going to give you the tools you need to repair and replace and reconstruct your articular cartilage in your joint. And so this is important too. Because the cells are blank slates or immune privileged, they cannot be rejected by your body or anyone else that receives them. So there is no donor-recipient tested needing like in an organ donation. Also, because these cells do not come from a fetus or an embryo, they will not grow into unwanted tissues, such as a tumor. The cells that we use at XCELL Life are referred to as multipotent cells. They're safe and they're effective. Again, these are donated. There's no abortions, no fetuses, and no embryos involved. So this treatment can repair, replace, and reconstruct your tissue. And these donated cells from a new birth can activate, again, the dormant cells in your body, which can also repair, replace, and reconstruct your tissues. It can reduce inflammation, restore normal body function. Regenerative medicine is working on a cellular level in your body. Your body accepts these cells as if they were their own, and then it fixes itself. So 1 million cells will become 2 million cells, then 4 million and 8 million and 50 million, 100 million, and then on and on. They will continue to multiply and heal you for up to 4 to 8 months. Every second of every minute of every hour of every day for 4 to 8 months, this treatment is working to repair, reconstruct, and replace your joint tissues and heal your body. So these treatments and stem cells are being extensively studied by science in labs, universities, and the FDA has approved hundreds of clinical research studies, maybe even more than that. The science is opening up new doorways. It's healing the human body in ways that were unheard of just years ago. So here's a short 2-minute video from the Mayo Clinic summarizing some of their research.
You're looking at a few hundred cells here that are working together.
The heart muscle cells that Dr. Tim Nelson views highlight recent advances into regenerative medicine.
The simplest way to explain that is it's the opposite of degeneration.
Tissues in your heart, joints, and other areas can degenerate or break down with time or disease. Regeneration is the renewal of those tissues, which is something the body does naturally.
So one strategy is to try to find ways to improve the healing of your body, and another strategy is to actually supplement or augment the stem cells in your body so that we can improve the healing by transplanting stem cells into it.
Dr. Nelson and his colleague Dr. Andre Terzik use stem cells in their research because stem cells are responsible for growing new tissue.
So stem cells just means that they're seeds that can grow into many, many tissues.
Stem cells can come from a variety of places: embryos, which are not generally used anymore, umbilical cord blood, or adult bone marrow.
So the type of stem cell will dictate how many different types of tissues can emerge out of it.
Scientists can engineer stem cells into the type of cells they want. Here's how it works. Cells called fibroblasts are removed from a patient's skin. They're reprogrammed into what are called pluripotent stem cells. Those cells can be taught to become any type of healthy cells, such as these heart muscle cells. The idea is that the newly engineered healthy cells, when introduced to, say, those of a failing heart, will help restore or regenerate the function of the unhealthy cell.
This is one cell that's contracting, is working with many cells, and that gives the whole tissue the contraction pattern like a normal heart.
It becomes much more real when you have a personal connection to a disease or an illness where we don't currently have good options. And this is where people are asking more and more of the questions, what about stem cells?
The answer is researchers such as these at Mayo Clinic push forward to make regenerative medicine a reality for patients searching for successful treatment and perhaps cures. For Mayo Clinic News Network, I'm Vivian Williams.
So a brief mention about us at XCELL. I'm Dr. Rob Almeida. I'm one of the owners. I've been a chiropractor for 30 years and have helped thousands of people with joint pain just like yours. Dr. Mike Mason is our head coordinating doctor. He oversees our treatments. He's a Harvard University trained orthopedic surgeon and he specializes in hip, knee, and shoulder total joint replacements. Our lab partner has a panel of more than 10 doctors that make up the treatment protocols that we use at XCELL Life. These program protocols have helped tens of thousands of people fix their pain. And I'm hoping we can accept you into this program to be helped too, because we only accept those that are a good fit for the program, because this leads to way better treatment results for our patients and program results for our office. So now let's speak briefly about how joint pain can affect us. Has your problem perhaps caused unhappy moods, irritability, reduced energy, restricted activities? Maybe it's made you a burden on your family because you're immobile. It's probably interfered with sports and exercise and so forth and reduced your enjoyment in life. And you know, looking at this fellow here, I hope not as much as him. But the big question is, why do you have the pain? Why is it not going away or getting better? Why is it getting worse? And this is because you haven't treated the problem successfully. Learning how to stretch and exercise in therapy, taking drugs or steroid injections, it doesn't regrow new tissue. They make you feel better for a few hours or a day, but they keep you sick and allow your body to continue to degenerate. So now regenerative medicine is another option. It's better than drugs, better than surgery, and better than steroids. So if you had a car engine light on, here's a good analogy. Like you needed oil or transmission fluid change, you could put black electrical tape over it and then you wouldn't see it. Well, this is what you're doing by taking drugs for your joint pain. Your body is broken and it needs to be fixed. You need to regenerate it, to regrow it. Will putting black electrical tape over your engine light or taking a pill regrow or regenerate your body? It won't. You can keep doing what's not working, or you can decide to resolve your problem because science now has an answer to fix you. If I can show you a way to get rid of your pain and do things again, your things, the things you like to do that you can't do anymore, would you want me to help? I suspect your answer to this question is yes, of course. That's why you're here. So for this to happen, you need cells that can repair, replace, and reconstruct your joint tissue. Lucky for you, our office uses regenerative medicine, and we can do this. Often these cells are referred to as stem cells, exosomes, cytokines, growth factors. They're biologics. They're referred to as a natural matrix. They come from living organisms. And remember, they're regulated from the first collection to post-processing by the FDA and the AATB. And these rebuilders, remember, can only be transplanted only from regulated, screened tissues donated at the time of a normal cesarean birth. It's a simple 15-minute examination and injection in our office. Our entire XCELL Life program is only 3 office injections, typically. We use FDA and AATB regulated 1-day-old cells and tissues. We don't need to give you 7 or 10 injections. At XCELL Life, we want our program to be simple and effortless for our patients. And what's most important to us is to get spectacular treatment results, period. So of course, these treatments reduce and eliminate your pain and inflammation. They repair and reconstruct and replace new bone, new articulate cartilage, muscles and ligaments, tendons, and nerve tissue. This is not a treatment program designed for temporary pain relief like drugs or steroids. These treatments, without drugs, without surgery, can repair, replace, and reconstruct your joint tissue and help your body heal. Regenerative medicine can get you functioning again, doing the things that you want to do. So also, depending on your specific problem, there are different treatments and different treatment programs, but generally speaking, in our office, after you're screened and examined, you're going to receive a series of 3 treatments over about 4 months. This is our typical orthopedic program. 3 injections. These 3 injections work to heal you for up to 4 to 8 months. The choice is simply yours. It's simply to continue to exercise and stretch, attend more therapy sessions, use drugs and surgery, or steroid shots with all the side effects that they have, or receive regenerative medicine XCELL Life in a simple office procedure and fix your body. So at this point, you have some questions forming in your mind, and I want to answer those questions. I also want to discuss the next step with you. This video is kind of like I'm talking and you're listening, but what really needs to happen next is a conversation. So what we find works best to answer all your questions and is super convenient is a private healthcare Zoom call. So in the bottom right hand corner, you can see in the video is a blue button. It's a link to my calendar. You can book a private Zoom call with me. This will take you automatically to my calendar when you click on the link, and you can select a day and a time that's good for you to have a Zoom meeting with me. So in this health strategy Zoom meeting, we can learn more about you, learn more about how you're struggling with your pain, and discuss what you've tried in the past that didn't work, and perhaps determine if you're a good fit for the program. I'm not saying we can help everyone, but what I am saying is, isn't it worth a chance to see if we can in fact help you? Again, all you need to do is click the button in the bottom right hand corner. You'll make a private Zoom meeting with me. We can pick a time to privately meet from the comfort of your own home, and we can get all your questions answered at that point. Remember, our purpose here is to help as many people as possible live a happier, healthier, and pain-free life. So here's the link again, and we'll include this link going forward in the video all the way to the end of the video. We truly are devoted to helping people live a better life, so I hope I've opened your eyes to the fact that you don't need to live in pain any longer. And my gift to you is at no cost to you a chance to find out if we can help you. I'm not saying we're going to be able to help everyone, but isn't it worth a chance to see if we can help you? If your answer is yes, click on the blue button in the bottom corner and we can make a Zoom meeting together. Okay, So if you did click the button, you probably found out that you can come back to the video. So I'll continue now at this point. So most people here pretty much want in. They want the treatment. It's a tremendous treatment. It works so well. But of course, you know, the main questions we get asked now are the money questions. How much does it cost? And does insurance cover it? Those are the two big ones. So insurance does not cover these treatments. But if regenerative medicine is not in your budget, we'll find an affordable solution for you. There are different treatments depending on your need, and we can fit these into your budget. Our office also has payment options. We have payment plans and financing, and we're flexible. We will never deny someone treatment because of money. We will find a way to make it work. And we can discuss these questions in our private Zoom meeting. In the Zoom meeting, we will find out exactly how you're suffering, and we'll find out exactly what we need to do to fix you. After this, we can figure out if you're a good candidate for the procedure and if we can accept you into the program, and then we can put together a money plan or a financial plan to fit into your budget. As a gift for watching, I want to give you an opportunity. It's the opportunity for a private Zoom consultation with me to be done from the comfort of your own home. And what we find that's so great about the Zoom consultation is almost always our patient, significant other, or spouse can be on the Zoom call too, either from their home or sometimes even from work. This is so important because we want them to understand exactly what you're going through, and we want them to know exactly what we're going to do to fix you. And we believe that if we can show them how you're affected and show them how we're going to help you, this will lead to more support at home. And this leads to better treatment results and outcomes. A consultation like this would usually cost $300 to $500 for sure. But today, it's my gift to you for watching this video. There is no cost. All you must do is click the link and make an appointment. There's no cost. We only ask that you reserve your appointment now. Our purpose is to help you live a happier, healthier, pain-free life. We want you to do things again, because if you're going to be alive, you might as well live. So we know your problem will only grow worse with time. You can probably remember 10 years ago, you probably felt a lot better. And then there's today. And imagine where you'll be a year from now or 5 years from now into the future. It's time to try something new. You've been working with what I call the big three treatments for orthopedic conditions for some time now: drugs, steroids, or surgery. There's really been no other options for us for decades and decades and decades, but now there is regenerative medicine. I want to say I can help everyone, but I just can't help everyone. This program has helped thousands of people already. You have nothing to lose. We will not waste your time or your money. If I can't help you, we won't accept you into the program. Please accept this gift. There's no better investment than an investment in your health. It will pay dividends forever. I do look forward to showing you what science can do for you. There is now a safe, effective, affordable solution to get rid of your pain. It's called regenerative medicine. I'm going to leave you with another video. It's a short, just 1 minute video. Thank you so much for your time today. I trust I've opened your eyes to the fact that you don't need to live in pain any longer. Science now has an answer for you. Thank you again. I'm Dr. Rob Almeida. Bye for now.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.